All right, everybody. It is 5 o'clock, that time we come together just about every day and make sure that we are committed to passing this test of humanity, to dealing with this once in every 100-year challenge, making sure we protect one another and we do what it takes to defeat COVID-19. But let's start the way we always start, by knowing and remembering that we're going to get through this. We're going to get through this together. Say it with me. We're going to get through this. We're going to get through this together. One more time. We're going to get through this. We're going to get through this together. I'm going to talk about how we're going to get through it the way we normally do. But right after we're done with this part, we're going to have a little bit of tough news that we got to breathe through. And so for parents at home, especially if you've got some young kids around, I'd find something for them to do here in the next 5 minutes or so before we discuss the very first thing we're going to have up. Sometimes we need to just be transparent and inform you about a couple of new developments that might seem kind of scary out of context, and we certainly don't want to do that to anybody's kids, including mine, if they're watching. So we're going to get through this because we're going to follow the 10 steps that it takes to defeat the coronavirus. Today we're going to talk about kycovid19.ky.gov. As we are doing a safe, steady, even gradual reopening, we've got to understand that most of the questions that we have on it are at kycovid19.ky.gov. So if you're a business owner and what's opening, you need advice, you need to know the requirements, it's on the website. If you are an employee and you want to know, is your place of business, is your employer doing everything they should be, it's on the website. If you are going in and want to know, is this place of business meeting the state's guidelines, again, it's on there. Now, this is going to be, as we go forward, opening up in a time of a worldwide health pandemic. Just very, very important to make sure we know where to go to get good information. And I tell you, the longer we've gone on this, the more intentional misinformation is put out there. It's put out by some that don't believe the virus is real, but let's face it, a lot of what's on social media right now is created by other countries in a way to try to destabilize us. That's the last thing we want. No, there are a lot of people out there internally and externally that want us to fail, that want us to fall apart, that want us to suffer big losses. We're not going to let that happen. We can't be doing that. So make sure you go to that website. That's where you get the accurate information approved by those in public health that you know that you can rely upon. So we talk about the 10 rules plus the 11th. Fill out your census. We are now 14th. We are now 14th. And I'm going to tell you, Indiana's ahead of us. Now, in this state, we never want the Hoosiers to beat us in basketball or in football. Let's not let them beat us on the census and take the money that we should get from the federal government. So, if all those years you root for Kentucky or for Louisville or for Murray State or for Morehead State or for Western, and I know I'm going to leave somebody out, but let's make sure that we beat Indiana because that's what we do as Kentuckians. So fill out your census. It just takes a couple minutes, and it will help us so much in our rebuilding process. Now, I'll give you a little more time. Let's look at social media. So we've asked, and it's become really important now. I mean, we asked before when we were going to be healthy at home for you to model the type of behavior we needed, and look at what it did for us. Look at how much we're beating every model by. Look at how we've plateaued. And when you see today's numbers, you'll see we have plateaued this pandemic. But being healthy at work is a little more challenging than being healthy at home because we have more contacts and it's a little more complex. And so we're asking that you model the type of behavior we need to see with all our former hashtags and healthy at work. So let's see what we have today. James is helping us out today. All right, I love this first one because, first of all, they make masks that have Team Kentucky on them. And right now, what could be more Team Kentucky than making sure that if you're asymptomatic, you don't spread this virus to someone else? That's what Team Kentucky is all about. When we started talking about it in the beginning, it was all about looking out for one another. So I love that piece from Granny Natalie. And of course, we got YMT News doing the right thing in their newsroom, just like all our journalists are here today, which we appreciate. But then I love this. So Photo by Gary B is open back up. But look at him, healthy at work, making sure they're doing everything they need to in their studio to meet the guidelines. So thank you to Photo by Gary B. And thank you for modeling, what we need to see from all our businesses. Grab on these guidelines. Do everything you can. Create as safe of an environment as you can, because that's what's going to create confidence for the public to utilize your services in this dangerous time, because it still is dangerous. Oh, so here's graduation. This is one of our Bellarmine graduates. Again, congratulations, and I love the quarantine style that's on here. It's tough. It's tough to have to graduate at a time when this is what you have to do. But thank you for the innovation, the creativity, and the sacrifice to those that are finding a way to make it special. All right, Elkhorn Baptist, I think, does more chalk art than anybody else we've seen, because this is the third or the fourth time I think they've been up. But they've got some really talented kiddos, and we want to keep seeing this, especially as we're in the summer. And people are saying, why can't we have a normal summer? And the answer is because we have a 1 every 100-year worldwide health pandemic. This is a good kind of reminder that there is still joy, there's still great things, there's still a lot we can do, but do it safely. Yeah, this is Mother's Day. And I want to thank Secretary Freelander for giving some guidance when he was up here right before Mother's Day about our ability to do these things. It's going to continue to be a hard month or two for our folks that are in long-term care facilities, but we know how dangerous it is. We know just one person really wanted to see their mom, their dad, their grandmother, their granddad that's asymptomatic can cause massive damage to a whole facility. It's hard. I mean, what this virus does is hard. And it shows that it's really, really hard in this situation. But we're going to get through it, right? In many ways, one of the things that we got to do is suck it up, know what the virus is doing, and then make the best of it through all the other means that we have to communicate. You know what? In 1918, they probably couldn't do this. They couldn't do Zoom, Skype, or anything else. It's hard to see a blessing in it, but we live in an age where we can still communicate, even if we can't be present. All right, I love this is to U of L Health, but we continue to see our kids recognize our frontline heroes. We have a lot of them. Here are healthcare providers. And the green lights continue to sprout up, to light up all over Kentucky. I think this is our true show of unity, of compassion. And I think when I look out at night and I see these lights, actually, when I walk the dog right around our house, I see about 4 of these, and then I see them up on the hill. I mean, it shows us that we're Team Kentucky, we're together KY, and we're in it together. And that drowns out all the noise. You see where people are, where their heart is, where their compassion is, and that's something that keeps us all going. All right, I want to jump before we do the let's do the sign language real quick to give everybody just a little bit more time. Today, given that we are Team Kentucky, we're showing compassion. We want to learn support each other. Support each other. Support each other. One more time. Support each other. So everybody, support each other. Again, we're in it together. All right, so we're going to start today by talking about a situation first that we have. Our goal has always been to be transparent, but making sure that we don't scare folks. And so this is one where we're going to have to kind of breathe through. And I'm going to start by saying I'm breathing through it too, because I'm the dad of a 10-year-old and a 9-year-old. So today we're letting you know that we have a 10-year-old here in Kentucky on a ventilator. due to COVID-19. We started seeing, a couple of at least COVID-related issues around the country, and I'm going to ask Dr. Stack to talk about this one. There's going to be limited information we can give you because we want to protect this child's identity and their family and the rest, but it's also important to know that this virus has reached one of our young ones, and let Dr. Stack kind of talk us through the science and the public health aspect of it.
Thank you, Governor. So the Governor's asked me to speak tonight to you about a new syndrome that is being recognized in young people related to the coronavirus. And so whereas adults will often get acute symptoms, and we can find that, we've said pretty consistently that we're concerned that children don't have symptoms when they get the infection initially. For those of you who are parents, you should still take great comfort that children overall do extraordinarily well with this and don't have serious illness. However, that when children overall don't have serious illness, that doesn't mean no children don't have a serious illness. And so there are a small number of children or adolescents or teenagers and younger children who can get a syndrome where their immune system apparently becomes overactive and they have a extensive inflammatory response in their body. And so in these individuals, I think what we've seen is that some of them can have a respiratory problem, others can have a gastrointestinal problem. There's not much you can do to prevent this except to take all the steps we've told you about, which is stay healthy at home, minimize social contact, have increased social distancing, wear a mask like we've all been wearing when you're out in areas where you may be exposed to other people. We've said repeatedly that this disease is still out there, that though we've had great success in blunting its worst impact at large across the state, it's still out there and it's still a danger. And so I hope you've all gotten to know me over 2 months, just like you have the governor talking at these press conferences most days of the week. I hope you hear I don't want to be sensational about any of this. I want to be just the facts and down the middle as much as I can. For kids who get this syndrome, it's serious. The young patient that we have in Kentucky is critically ill at this time. And for those who get this, it's serious. And until we learn more about it, until we find treatments that we can use to try to help patients who get infected, and until we find vaccines that can prevent people from getting it, hopefully, the only thing we have is to prevent all of us from getting it, hopefully by staying healthy at home and minimizing how much we spread this. So my heart goes out to the young man and his family so that he can have a full recovery and do well. But for all the rest of you, the healthy at work and healthy at home guidelines we give are still very, very important, and I would ask you please to pay close attention to them and follow them. Thanks, Governor.
So let's just pause for a minute. Take a moment of silence, and you do what your heart calls you to do, but anytime somebody's on a ventilator, it's tough. Having our first 10-year-old with COVID on a ventilator is tougher to me as a dad of a 10-year-old. Let's just take a minute, and everybody do what your heart tells you to do to help, pray, think about this kiddo. So, thank you all. It's too early to jump to any conclusion about numbers, about rate, or about anything else. And so we do this knowing you can take it. We've been talking about this for a while. We've been able to breathe and work through other situations, but it's really important for us to be transparent when we know that we have a case like this. And for me, as the dad of 2 kids right around that age, my goal is to always be treating this like it's real, to never think that my kids are somehow immune, to never think that I am either. One of the reasons that I wear a mask is to not bring it home to my kids. And I don't know how effective it is at that, but if it is even 5% effective, it's worth it to me. And I don't want to spread it to anybody else's kids either. So with that, our numbers are still holding pretty steady. So Sundays, Mondays are a little bit lower, but we had more that were coming in on this Sunday. So Sunday's number started with 141 new cases, and that was coming from. I'll give the totals on Monday. By county was 30 from Jefferson, 24 from Fayette, 13 from Boone, 12 from Kenton, 9 from Davis, 5 from Logan and Warren, 4 from Adair, Allen, and Ohio, 3 from Callaway, Muhlenberg, and Webster, 2 from Campbell, Grayson, Henderson, and McCracken and Perry, 1 from Boyd, Graves, Jessamine, Lewis, McCreary, McLean, Nelson, Pendleton, Spencer, Todd, Whitley, and Woodford. And just of Sunday's cases, again, so we remember that it can strike anybody, a 20-year-old female from Kenton, a 6-year-old female from Boone, 21-year-old male from Ohio, a 23-year-old female from Adair, a 23-year-old female from Graves, a 24-year-old female from Ohio, and a 24-year-old male from Allen were amongst the cases from that day. And again, we've heard when we read other things that have happened, people of other ages. This is just a reminder that I think close to half of our cases are 50 and under, and so it's just something I want us to all be mindful of, knowing that we've got to do our part. Now, you may say, but when you look at the death statistics that are older, well, somebody is passing it, spreading it to the folks that are older. And so if we realize that so many of the cases are happening with those 50 and under, I think that we start thinking about the number of asymptomatic people and how it can be spread. And just important for us to remember, and we talked a lot about it 2 months ago, that it's our duty not just to protect our family, but to make sure that we're not spreading it to other people. So on Sunday, we also had 3 new deaths, and that brought our death toll at that time to 307. And those were a 73-year-old female from Jefferson, a 90-year-old female from Jefferson, and a 67-year-old male from Allen County. Now, when I talked about it holding steady on Monday, today, we have 105 total new cases. So both of those are under what we've typically been seeing, but tomorrow or Wednesday, cases will catch back up. We've seen big Tuesdays, and we've at different times said, oh, it's the biggest day, but again, it spreads out over several days based on when labs are open and they're not. So when we say it's plateaued, it has, and it's plateaued even with a lot more testing that's been out there, and that's good news. Now, it's hard to say it's good news when there's still 100-plus people a day having something that can be deadly, and it's not good news when anybody passes away from it. But in dealing with a worldwide health pandemic, this is a good sign in where we are, but we got to keep it up. So for Monday, we're reporting 105 new cases of the coronavirus, which brings our total state cases to 6,677. That is 6677. Of those, 23 are probable, and the rest are lab confirmed. That's out of a total number of tests. You'll see this has jumped of 104,001. So that's 104,001, and we still have a couple of major labs that run a lot of tests that haven't reported in a number of days. They've reported their positives, not their total number of tests. So we know our number is bigger than that. So when we look across the nation at a lot of similar states, our testing is catching up very quickly, and I think comparing and will compare very favorably. Our hospitalizations total ever 1,767, currently 383, ever in the ICU, 768. Currently, 220. That's down 2. I'll celebrate that. That's down 2. And total number of recovered, 2,335. Of just a couple of the new cases that are out there, a 6-year-old from Warren. And let me say, they're working really hard in Bowling Green. Mayor Bruce, who is a friend of mine there, former law enforcement, has worked really hard in that city to raise awareness. And I will say, as Attorney General, every time that I was in Bowling Green, he was there, just wanting to do the right thing. We appreciate you, Bruce. Keep it up. A 19-year-old male from Jefferson, a 12-year-old girl from Warren County. Just again, an acknowledgement that this can spread through anyone, anywhere. When we look at the new cases by county, it is 40 in Warren, 19 in Jefferson, 9 in Boone, 6 in Butler, Kenton, and Logan, 3 in Rowan, Shelby, 2 in Christian, 1 in Bath, Bullitt, Campbell, Davis, Grant, Grayson, Greenup, Henderson, McCracken, Muhlenberg, Pulaski. And so while we haven't seen anything for tomorrow, I would expect a somewhat higher number than that with kind of the plateau that we have seen, but how the numbers change as they come in being reported. For today, we're reporting 4 new deaths from the coronavirus, and that brings our weekend total to 7. They include a 72-year-old female from Jefferson, a 72-year-old male from Bullitt, a 79-year-old female from Hopkins, and a 69-year-old male from Henderson. So these are 7 Kentuckians that we've lost, 7 families that are grieving, 7 more individuals out there that need every green light that we have lit up, that need every bell that we ring at 10 a.m. every day. These 7 are just as important as everybody and anybody else that we have lost, and let's make sure that we pay the same type of homage to them and put the same type of effort in so that their families know that we are fully with them. Breaking down race and ethnicity, total number of cases on race, 73.91% white, 14.15% black or African American, 6.43% Asian, 5.35% multiracial, and on ethnicity, 87.16% non-Hispanic, 12.84% Hispanic. On the death side, 77.98% white, black or African American 18.77%, Asian 2.17%, multiracial basically 1%. And then ethnicity breaks down to about 98% non-Hispanic and 2% Hispanic. But again, the people that we read about, and we do it every day, don't we? Ages and counties. It makes it feel like it's not real. And I know it is because I actually, at different times, see every name that comes through. So the more I can, I want to talk about these individuals. It takes families reaching out to us because I want to respect their wishes. But today we're going to talk about Robert Wright, 66 years old, from Litchfield. He passed away April 30th after a difficult 3-week fight with this virus. He was a loving and devoting father to his 2 children, Victoria Wright Kiefer and Andrew Wright. He was a supportive brother to his sister Maureen Fletcher and an attentive uncle to several nieces and nephews. Robert was a proud 7th-generation Kentuckian. He was an avid collector and historian. Professionally, he was creative and an industrious entrepreneur. Robert loved the outdoors. We see a little bit of that, don't we? He enjoyed fishing, hunting, hiking, and especially falconry. He was a lifetime member of the national parks and greatly enjoyed traveling. Throughout his life, he served the community as a volunteer firefighter and a Boy Scout leader to Troop 135 and was a member of Masonic Lodge 236. Robert was a loving and helpful man with a beautiful soul. He left us much too soon and will surely be missed by his beloved family and friends. Look at that, Pikes Peak. Robert's family asks all his fellow Kentuckians to please take this coronavirus seriously and to follow the practices and protocols of our health experts and what our officials recommend in order to stay safe and to stay alive. 66 is far too young. So remember, this virus takes people before they are meant to go. Those of you that tell you that it's not deadly or if it's just like the flu, none of that's true. This virus takes people before they're supposed to go. Robert should still be with us, and I know his family would agree. And that should be enough for us to keep going. So tonight, for all of our folks, but how about for Robert? Let's light our homes up green. Let's let his family know, now that they'll be watching tonight, that we love them, that we care about them, that we care about every other Kentuckian that we've lost. Team Kentucky isn't just about how we get through the coronavirus. It's how we feel and care about one another. It's about our sense of identity as Kentuckians, knowing we share so much in common. So we will miss him. I know his family will miss him. Let's remember this is very real, and the people we lose are very real. Long-term care facilities. This is a total since Friday. So this is Saturday, Sunday, and today. We have an additional 27 residents that have tested positive, 9 staff, and 5 additional deaths that are all residents. This is why we are doing the very targeted testing that we are. I believe that we have one of the best plans in the country after seeing a list of those that are out there. I believe that what you will see in our testing program is that we are absolutely going to prioritize those that are most vulnerable. And we're going to continue to be transparent and put this up each and every day that we have something to add to it. All right, let's talk briefly about testing. We want to make sure that we get the type of testing we need to safely do Healthy at Work. When we look at testing locations that we have across the Commonwealth from May 11th to May 15th, look at this. You probably can't see it because there are too many. On here we have 37 sites that are doing testing and drive-through testing just this week. And then we have the 13 sites that First Care is doing. So I believe this week we have 50 total sites or more doing testing for COVID-19. If I sound excited about this, even though my voice has sounded like this for far too long now, I am. We went from battling every day to get swabs and starting out with just our state lab to having 50-plus testing locations. So our challenge now isn't having the tests, it's getting you to take the tests. Because if we're going to be successful at doing Healthy at Work, we got to test over 2% of our population every month. I will tell you, with what you just saw, with these two together, we have enough to test 4 to 5% of our population. But you got to show up. So we need to make sure that we are signing up at every location. If you're an employer, you need to be encouraging your employees to get tested every so often. That'll help protect you all. If you are a faith leader, go get tested. Make sure as you're inviting people back in that you and maybe your ushers and other people know how you would test. How about those that are a nonprofit community, those that are serving those at need? Make sure that we get out and we get tested at the level we need to. Now, with all of these up, you need to go to our website, right? kycovid19.ky.gov will show you the requirements and how to sign up. But it's now in every region, in every part of the Commonwealth, there is something close to you to get a test. Remember when we used to say, I want that day where everybody who wants a test can get a test? Well, that day has already come, and it is here, and we need you to take advantage of it. And specifically for this next week, for our Kroger drive-through sites, if we can put the sign-ups up, we need the Corbin area to sign up. We are close to being full this Tuesday, but Wednesday and Thursday combined, we have 800 or 900 spots available. And I know I've seen folks that have talked about different plans on reopening the economy, and everybody should have their own ideas, but all of it is based on getting the testing. And so we need this and every other area of the Commonwealth to sign up. So please, if you are in the Corbin area, if you are anywhere within a couple of hours or an hour, sign up. We need to use every single one of these tests. KrogerHealth.com/COVID testing. Please, let's make sure we use every test in every region. That will give us the best information to protect you. So, small business, you want to open up your retail, which is coming up. You want to be able to tell your customers that your facility is safe, which I believe you're going to be doing that. Make sure you sign up and you get that test. You want to encourage your employees that will be coming back on the job in a couple weeks to go and to get that test. Let's make sure that we get that done. Now we'll ask J. Michael Brown to come up and to give us an update on the Green River Correctional Complex. We've taken a number of major steps there. Many of them are complete. He'll give us an update now.
Thank you, Governor. Well, at Green River, we have now tested 1,081 staff and inmates. Of that, the results that have come back show we still have, and these numbers are stable now. They're the same as they were at the end of last week, with 50 staff and 350 inmates which have tested positive. We have 4 hospitalized, 2 staff and 2 inmates, and 2 of those are in ICU. As we told you last week, once we got this whole universe of testing done, we were going to separate them into groups for their own protection and protection of the public. And that division is that those who have tested positive would be housed together. Those who have tested negative but had been exposed to someone who was positive, they would be housed together. And those who had tested negative but had not been exposed, they would also separately be housed. In addition, we have provided for a group of individuals who are in a vulnerable class to be housed separately from everybody else. We have shipped additional thermometers, and this afternoon, as a matter of fact, we were training more staff to assist in the taking of temperatures, because we want to do that on a much more frequent basis for that entire group. Working with Dr. Stack's staff, we have been arranged for a future retest of certain of those populations as these test results comes back, because we know that this thing has an incubation period, and we want to be sure that we catch particularly those who were positive and exposed. We have Aramark is back in business on food service, and we're working to get a more regular feeding schedule. As you know, what took place last week and over the weekend was basically everyone in the institution had to move to a new facility, a new room, a new part of the institution. And that was completed Saturday. That was a big job. So we're going to be doing more face-to-face checks. They call that going door to door. We're going to be doing more thermometer checks. We're being sure that inmates have access to both phones and showers. So, thank you, Governor.
Did you mention how tests are being reported?
Pardon me?
Did you mention how tests are being reported? I'll do it.
Yeah.
Yeah, okay. This is what happens when I question Michael Brown. I should never do it. I do. I mean, we get sent things just about every day. Do want to say I love what Hardin County has done, both in their pride for being a part of Team Kentucky, also showing their compassion for those that we have lost, but also knowing the color of renewal that we will have a better day. You know, these are some of the things that may have seemed small before this, but show a type of unity, togetherness, and commitment, and also pride. I know E-Town came together and has filled up all their testing slots in a way to where you can see that they want to have a safe community. Got many friends down there, their sheriff being a great friend, and I know that they're going to take advantage of their testing they're going to have. Let's talk just real quickly about Healthy at Work, since today was a big day. A lot of our businesses coming back online in a slow, gradual reopening to where we can make sure it's safe based on the timing. One where we are not the first state to go, because I don't want to be the fastest. I want to be the smartest. This is, again, a list of things that are opening in May with more to come. We now have guidance out, I believe, for everything through May 20th. We are working on the 22nd. Our belief is that very specific guidance and requirements creates a level playing field where everybody is treated fairly, but more importantly, everybody knows what it takes to be safe in this environment. Just because we've plateaued doesn't mean the virus has gone away. With the 10-year-old we talked about right now, we all ought to remember that it's very, very serious. And let's remember the rules, because the rules are critically important to making sure that we not only reopen, but reopen safely. And these rules can be found in the White House guidance, can be found through what public health officials are saying, through the CDC. And remember, if you're opening any type of facility, organization, or the rest, that these are really important. Now, just because you could open doesn't mean that things can go back to normal. They've got to be a very different normal. If your business is one where you can telework, you still ought to be doing it. And the rest, it's just, these are the types of things that if you don't do, the virus spreads, and no one wants their place of business to be known for that. Testing plan. We have now provided the lab information, whether it's First Health working with Solaris or Blue Water, to where everybody across the state has the information to where they can send somebody to be tested. It's going to be really important, because if someone shows up to work and is sick, or calls in who are sick, you want to make sure whether they have this or they don't. And then I just want to start talking about the way the world will look with contact tracing. Because, for those that are a little anxious, for those that want to get out, you got to understand with this new world that you may get a call. That's the way that it's going to work when other people are out to do a little bit more that say you've been in contact with someone who has tested positive. And for that, you're going to have to self-quarantine for a period of time. That's the only way that Healthy at Work can work, with testing and contact tracing. That's what they're talking about all over the country. It's going to be very different, and it's going to require us to accept that call when we get it and be willing to do what it takes to protect our families, to protect our workplaces, and to protect our communities all around us. It's going to take, maybe you're that person that just got out to do some new things, and you get that call, and you're one of the very first. And the question is, will you step up and do your duty, understanding that by not doing it, you could otherwise be spreading it to more people. So we're all worried about our economy, but I will say the economies that thrive coming out of this are going to be the ones that don't have to shut down a second time. And so the rules about Healthy at Work are rules that give us continuity and that give us long-term success. If we opened everything up tomorrow with no limitations, first of all, we'd spike, we'd lose a number of Kentuckians, people would die. We all know that. But the other thing we'd have to do is shut down our economy to get containment on it again. And those two hits instead of, one hit and a gradual reopening would cause us more damage. I believe by doing this right, by doing it on our plan, that we will have long-term success, and that success can just build. We prove that we can do it during this pandemic, then we can increase the capacities at restaurants or other places as we go, and we can do a little bit more and a little bit more. But remember, the number of contacts you have in any given day is very important, even with the opportunity to have more. So if you've worked and you got a haircut, maybe you shouldn't also go to the grocery and do another thing, right? So moderation, each day, remembering that the lower you keep them, the safer you are. And just because you can do something doesn't mean you should do something. It's going to be a different couple months. It's going to be a different summer. I know there are those out there that want this summer to be the same as all other summers for our kids. I wish it could be the same for my kids, but it can't. And I'm not going to risk our and their health to try to make it exactly the same. We'll get past this. We'll get to the vaccine stage. Maybe the virus will die out. We'll find a very good treatment. But until we get there, it's still very real. Our battle and our war is still ongoing. Remember that Greatest Generation? It wasn't a 2-month or a 3-month thing. It was a multi-year effort that they didn't even know they were going to win. So with us knowing that we're going to win this thing, and for us knowing that we're not looking at years, let's continue to have the resolve to get it done. And let's not be that generation that could do something for 2 months, but 3 months is just too long. Now, we can, we will, and we should do this. We're proving we're great, amazing, caring people. Let's not turn our back on that. All right, so with that, let's get to questions because we are doing better at running on time. Here today we've got Tom Latek, Morgan Watkins, and Lawrence Smith, and we have got some questions from journalists who are watching. Let me start with one of those, then we'll go to Tom. How many government workers have so far tested positive or died from COVID-19? Based on the information that we have, 61 employees have tested positive, and thankfully there have been no reported deaths. We have had no members of the governor's staff who have tested positive. We had one individual whose daughter tested positive who self-quarantined. It was actually more than 2 weeks. This was at the time where the test took like 3 weeks to come back, which tells you why now we require for the testing that we push for it to come back earlier. She ended up testing negative. We missed her, but we knew it was important to do this the right way. Tom.
Governor, you've talked about reopening state government. When will it be? I've had people actually ask me this. When will the Capitol and other buildings and other facilities be open for tours once again?
Okay, the question is on government reopening. We have put out guidelines for, say, courthouses and others to begin to slowly do it, even as early as May the 18th. But the question is on tours. And so we've really got to think about the necessity of everything as we work through it. So when public buildings first come online, it should only be for the general public for the most essential services that can't be done for everybody on a computer or over the telephone. We are going to try to model what we're asking everybody else to do, which is every service we can provide digitally or over the phone or through a Dropbox or through the mail. We're going to continue to do that. So I think tours are a ways away. We can work on virtual tours. I want our classrooms, when kids are back in the classroom, to have opportunities. But we're going to come back at 50% or less. In the Capitol, we're going to be below 50%. And knowing that there are critical government services that happen here, we're going to be very careful that those who come in are just getting the critical government services that they need. What category do outdoor weddings and venues fall under? Would this be part of gatherings of 10 or less and subsequently gatherings of 50 or less that are allowed in the summer? Weddings can be done pursuant to that, the 10 or less, and the 50 or less when those times come, outdoor weddings especially. And we can potentially look at other guidance for that, but remember, 10 people isn't 10 people altogether. It's 10 people engaged in social distancing. It's 10 people that aren't taking that photograph all together. I know that's hard. Maybe you could take people individually and put them all together digitally. But yes, once 10 groups of 10 can come together, certainly to socialize, again, with social distancing. We really got to point that out. So think about it. If you're a family of 4 like ours, and at that point you want to have another couple over that also has 2 kids, you're all sitting 6 feet apart from each other, and you really got to talk to the kids about it. It's going to be hard for the kids, but you got to talk to them about it. Think about different things that they can do that don't have that direct, close contact. I know it won't be perfect, but I do need everybody to try, right? In this new normal, I need you to try. Morgan?
The 10-year-old who's sadly on a ventilator,
Yeah.
Dr. Stack mentioned that he's experiencing the inflammatory syndrome that's related to the virus. Have any other cases of kids suffering from that syndrome been identified in the state so far?
So the question is, our 10-year-old who's on a ventilator, is he the only child? I'd say is that child the only child that is suffering from what we see in that syndrome thus far? Yes, to our knowledge. You know, in New York, by the time they recognized this, there were more children. I think they're now up to 83 they're looking at, 80-something. It doesn't mean that many have it. But this is the only one to our knowledge right now. I don't know if the child in Louisiana was suffering from something similar. I don't have that information. This is about Cumberland Falls cabins, about being used for first responders. We are reevaluating all of that. We do need enough space for first responders. We need enough space if we have another spike for overflow, but we are looking at a schedule where we can open up some of our lodges and campgrounds because we would rather have Kentuckians going there, engaged in social distancing, than certainly going to another state that isn't enforcing some of the things they are, and also have people from lots of other states coming into them. So we want to try to create something, if you want to travel in the summer, that you can do it here in Kentucky. But again, being really careful about how we do it. Lawrence? Yeah.
Question for you and one for Dr. Stack about the 10-year-old. What can you tell us, if anything, about the location and gender of this child? And then for Dr. Stack, if you could talk more about this syndrome and how it presents itself.
From my side, we're not going to we can't divulge the gender and location of the child because it's just one child, and we want to protect the child's privacy as much as possible at this point. When we have the opportunity to provide more, we will. Dr. Stack, do you have any other comments on the syndrome generally and how it manifests?
Yeah, thank you. So the question is about when these children get this inflammatory process, and I didn't do a very clear job explaining that. I don't think we have an absolutely clear pattern. The challenge is the child's immune system becomes hyperactive, and so some of the presentations have been children coming in with abdominal pain and could look like someone who has appendicitis or a problem like that. Others have come in and have a respiratory infection. It depends on which way the virus gets into your body, whether it hits your respiratory system or your GI, gastrointestinal system more powerfully. That in and of itself doesn't seem to be the big problem. The problem is then once that starts, the inflammation goes out of control, and then it hits the child's body overall, and they have a lot more problems. So there's just a lot we don't know about it yet, unfortunately.
I think what Dr. Stack ended with is a really good point, that we forget that this virus, at least to our knowledge, didn't exist until very late December. We didn't have our first case until the first week of March, I think. So there's still so much that we don't know about it. But because we live with the news cycle every day on it, because on cable news it's on every minute, that in many ways we feel like it's been around longer than it has, and we should know more than we do. So let's remember that we're all doing the best we can, and this thing continues to change, and we continue to try to be fluid and to adapt to it. That's why we need you to stick with us to get the very best information that we will continue to provide. Maryville Baptist lawyers asserted that drive-in worshipers were given quarantine notices on Easter Sunday, and the Sixth Circuit considered that. Governor said it shouldn't have happened, but it hasn't been established whether it did happen or not. I can say that KSP told me that no notices were placed on cars that people were still in. That if folks had stayed for the drive-in service, that they didn't get those notices, and they shouldn't have. We have always been supportive of drive-in services as a safer version. Now, of courts have ruled that services can restart now. We had hoped for a May 20th date that we had worked with a lot of organizations to give congregations the time to do what it takes to make it safe. Simply opening a building and doing something the way that we previously liked to isn't safe right now. Everybody should agree with that, knowing that when we sing, we spray, even when we sing really lovely. And that spreads the virus. A Washington choir got decimated through this. One of our first cases, one of the first spreads was two ladies who sang next to each other in the choir. If we don't do the deep cleaning and someone touches the surface after coughing in their hand, it can stay on that surface for a while. And a lot of our services, required hugs or handshakes, and ours, right in the beginning, we get up and we give each other handshakes and we hug each other, and we know that can spread the virus too. So we just wanted enough time to provide the education to congregations as we go back. And there are most every church in Kentucky that are trying to do this right. Now, I know we had one that opened in Frankfort that, if you watched the video, weren't observing social distancing at all. No one was wearing masks. They were doing all the things that we know spread this virus. I know that most churches out there won't do it. But please, just try to follow the guidance the best you can. Nobody wants a sanctuary to become an unsafe place. That's the opposite of the definition of sanctuary. And I know my God would want us, when we come together, to do everything we can to love one another and protect one another and not put them in a dangerous place. So regardless of your faith or how you view it, please realize this virus is real, and God gives us wisdom to know the steps that we can take to make sure it doesn't spread. And to all the major organizations that are out there that have worked with us, thank you. Thank you. I know it hadn't been easy. I know some of your congregations have pushed back, but you're trying to make this as safe as you can. And for every group, house of worship, business, organization, governmental entity, wait until you're ready. Wait until you know that it is safe. That's our obligation to one another. Tom.
Governor, we had a case where you and the Attorney General were on opposite sides of the lawsuit. Imagine that.
A governor and an attorney general on opposite sides of a lawsuit.
Never happened before. It turns out, though, that the Attorney General was the law clerk for the judge that heard the case, and the judge also swore him into office here. Shouldn't one or the other not have recused from a legal standpoint?
Question. I'm gonna repeat the question so people don't think is that we had a recent case where I think the Attorney General and I were on different sides. The Attorney General had been a law clerk of the judge who heard it, and the judge who heard it had sworn him in. Is that okay? I want to make sure that that's me repeating what you said and not. And should that cause a disqualification? I think I will ultimately lead that up to the judge. I know that was all pretty recent, but I hope everybody was trying to do ultimately the right thing. I believe that decision that came out said that while churches could open, they did have to follow CDC guidelines. And so if people aren't 6 feet away, they're not satisfying that judge's order. If they're not following social distancing, they're not satisfying that judge's order. I know that there are folks that have been sworn in to different judgeships recently that have been active in politics. That's kind of a new thing we see. One of the judges on our Sixth Circuit panel had been general counsel to the Republican Party of Kentucky. Now, he's a good lawyer, and I hope that he's just doing all the things that he believes is right. But recently there's been a lot more, it seems, of those contacts. But federal judges, are sworn in, have lifetime appointments, and hopefully they do what's right by the law and what their conscience tells them. And I'll certainly, as a formerly practicing lawyer and probably a future practicing lawyer, hope our judges will always do the right thing. Let's see, have we thought about a schedule for reopening lobbies or customer accesses to banks and credit unions? We actually didn't close those down. They chose to do that, but as long as they can meet the guidelines that we set out, which they should for forward-facing businesses, and even when retail comes out, it is out, our guidance. If they follow that, we believe that's pretty good guidance. Morgan?
So there have been issues with getting the data on negative test results back by
Yes.
companies at the state. Are you any closer to getting those results back, and what's the holdup with, labs?
We are getting closer to getting, we believe our data on positive tests is accurate. On negative, it's not yet. And part of that is under laws that previously existed on other types of illnesses. You had to report positives. You didn't have to report all your negatives. So we're making sure the law catches up to what we're dealing with right now. We've had the National Guard calling through every single lab that reports to us, trying to get an accurate number. We still have some very large labs that are outstanding. Our hope is that this week we can get that resolved. But the challenge here is so many different labs are doing work across the Commonwealth, and they're outside of the Commonwealth. So we're always going to have kind of a beast to deal with, but we believe it's getting better and better. Now, I believe our total number, while it is up, is still low, and that does impact the data. Our mortality rate is now, I think it's close to 1% lower, or it's getting there, than the national rate. And that's because we've gotten more of the negative tests in. We can compare the total number to that. Our percentage of positives, goes down when we have more accurate data, and so it's important to get. A few weeks ago, we talked about the deliberate phase-in of people over 60 and others with at-risk conditions. Is it still suggested with more and more business and organizations opening up? Yes. This is one of the most challenging parts of reopening, that the world and this virus is still very dangerous if you're in that group over 60 or with heart, lung, or kidney disease. It's still very dangerous. And especially to those 70 and up, when you look at it, the mortality rate there is really high compared to just about anything else that is out there. So please wait. And employers, please work with folks that are in these at-risk populations. When we talk about reopening and being able to do it safely, we expect and we trust you to work through with those folks that would fall into those categories. And that can't be, well, you can take unpaid leave. That's going to force people to come back. So we need everybody's very best, and we need everybody's encouragement. If you fall in those categories, stay home until phase 2 in the very least. Lawrence.
Many daycare centers carry insurance that protects them
Right.
if they're closed because of an infectious disease outbreak. But some are being refused because they close without having a positive test being noted in their daycare center. What help can you offer them, and when will you have more guidance about daycare centers?
So I believe our daycare centers are being treated wrongly by their insurers who are denying their claims because they had to close. When they had to close, we were doing what we do in every major outbreak. When there's major outbreaks of the flu, we look at closing schools and potentially at closing daycares. And to say there has to be a positive test in one of the kids, that's not the right way to look at it. We know that there's a major outbreak of a very serious virus, and this is a step we had to take when we didn't even have the testing capacity because the virus hadn't existed before. So I think those insurers need to do the right thing, support our child care centers, because we need them. In the long term, we're going to come out of this, and we need a very healthy system. We're working on that guidance right now, but I think our child care centers know this. It's hard. It's really hard. We can't just ignore the virus that's out there and say people need this support to go to work, even though they do, but the virus is still out there. And so we got to do the best we can to lessen the likely spread, which happens with kids. And we've got 5, 6, 8, 10-year-olds that have this, while at the same time finding a way to create this support. Now, one thing we're working through is employers, and large employers certainly are exempt from our order on child care if they run their own. So what that does is it kind of creates a bubble around those contacts, right? It's still people in the same work area. And we've had some proposals just run past us. Toyota's one. about some really good programs. So that's one area we can work with right now. That doesn't help a lot of people, and we gotta work through and get to a point where we can help others. When restaurants reopen, other states, including Maine, will require wait staff and sit-down restaurants to write down the name and contact information for at least one customer at every table. Right now, we're not planning on doing that with just about everybody paying digitally. By credit card, we believe that we're going to be able to track through them. Let's do one more question each, and we can get out of here.
Okay, thank you. There are some people that have contacted my people who are confused in the difference between executive orders, mandates, guidance, and what's the difference in guidance between should and must?
Okay, the question is on some of our guidance out there. Should is that you absolutely should, but you're not going to be penalized if you don't. But every public health official and everybody in government that deals with public health are saying if you don't do that, you're putting your people at risk. Must means you need to do it. Morgan.
Today was the first day that it was widely recommended people wear masks in public, kind of as a matter of moving forward, and businesses have the right to turn people away if they don't have a mask. How did that first day go? Did you get any complaints or issues about that?
So this is the first day where we have asked, recommended, and pleaded for people to wear a mask. So I saw some people out there questioning, well, we didn't do it before, why would we be doing it now? Because you were healthy at home before. Because we were asking you to have no contacts with anybody else. And now that people are going healthy at work, you're going to go from just your family to a whole bunch of more contacts. So as your risk elevates, steps to mitigate that risk are what we are asking for. And this makes sure you don't spread it to other people. So think about, first of all, if you're asymptomatic, lots of people are, you don't want to be the cause of someone else contracting this illness or potentially even dying. This keeps it from happening. But if you're wearing it, it encourages other people to wear it. If other people are wearing it and they would otherwise cough in your direction, this may protect you. But if you're not wearing it, how can you expect somebody else to wear it? So all of us doing this is a way to make sure that we protect one another. We're actually seeing some pretty good compliance with it. And if I can, I just want to say we're seeing perhaps the best compliance anywhere in eastern Kentucky. Folks wanting to protect their neighbors, caring about each other, whether it's at the hardware store or anywhere else. We saw county judges and mayors acting some of the earliest, even though there weren't a lot of cases or sometimes even any cases there. This is a region that has done an incredible job at responding to it, and whose people have come together, really quickly to address this. And I'm really proud of Eastern Kentucky. I'm proud of all of Kentucky, but what we've seen particularly in that region is pretty special about how people are responding and reacting. All right, Lawrence, last one.
Any plans for testing sites in central and eastern Jefferson County?
Any testing sites, any plans for testing in central and eastern Jefferson County? Right now we're going to continue our Shawnee, not just this week, but next week. We have Bashford Manor that is going to continue into the future, and we'll see about testing sites beyond that. I know Norton is working with other groups to have walk-up testing, and that's an area that the Kroger sites and the Walmart sites don't satisfy, and that's an area we need those gaps filled. Still working on other locations in Jefferson County. We do need to have a testing presence continually there. All right, everybody, Sunday and Monday had a level of cases, again, that are plateaued, but that shouldn't lull us to sleep. We know the virus is still out there. Let's remember that we've got a child that needs our thoughts and prayers tonight. But let's remember that moving forward, there's a lot we don't know about this virus. So as we reopen, follow the restrictions. Let's continue to be the great Kentuckians that we are. Care for your neighbor. Ask everybody else how they're doing. Be careful as you're going back to work, but mainly remember that we are all tied together in this. We are Team Kentucky. And we got to continue to work to defeat this virus. We have a pretty special closing video for you. That's a compilation by some artists here in Kentucky trying to celebrate and bring us together, knowing that we still got a lot of work to do. See you at 5 tomorrow.
earth.